recovery can be a very tough journey. Soul Surgery is here to talk about a solid solution for those that have been struggling for years. I'm joined with Medical Director, Dr. Tepete, and IFM practitioner, Ted Fulop. Welcome, gentlemen. Thank you for being here today.
Thank you.
Absolutely. All right. So, Dr. Tepete, we're going to start with you. What is soul surgery?
Soul Surgery is an integrative center that specializes in substance use disorder and psychiatric disorders.
Okay.
Our goal is to admit patients to our facility that have already transitioned from the detox phase and they're not quite ready to be at the inpatient rehab phase, or someone who doesn't meet criteria to be in a detox facility and needs some stabilization.
Gotcha. Okay, so I know you use Eastern and Western medicine. How do those two things work together?
Well, we have a stabilization unit at Soul Surgery where we are fully staffed with 24-hour nursing, medical providers, psychiatric providers. We use evidence-based Western medicine.
Sure.
And then we have a specialist here who specializes in functional medicine, Oriental medicine, and acupuncture. And he deals more of treating the patient with a holistic approach so they can transition into the rehab phase and then being able to fully engage in the learning process to maintain sobriety.
Great. I love that both of those two things work together to treat the whole person, like you said, the holistic approach. So, Mr. Fulop, tell us a little bit about the functional side, the Eastern side, which is what you specialize in.
Yes, the body's always going to want to be in homeostasis, in balance. The body doesn't like to be off balance. So patients that are seen first by the Western medicine practitioners come to me to visit with me, and I treat their spiritual side, I treat their mind, I treat problems that they were battling with, such as pain. Pain, sometimes pain is the starter of all things.
Yes.
And once they sleep better, they feel better, their spirits are higher, and their recovery is much faster.
Absolutely. Well, if you
Yes.
feel better in your body, of course it's going to make the journey, the road to recovery so much easier. And I love that those two things work in tandem, work hand in hand to lead your patients down this road to recovery. Okay, so tell me some of the outcomes that you guys see using these two forms of medicine together.
What I've seen a decrease in medication use. I've seen improvement on their sleep quality, and I've seen an improvement on their pain level.
Wow.
Which all three of them are very, very important towards recovery.
Absolutely.
Yes.
Well, yeah, like we were just saying, when you sleep better, when you feel better, this is all going to be something that is going to make your recovery a lot easier.
Definitely,
all right. So
yes.
tell us a little bit more about some of the patients that you've worked with. I mean, have you heard any great stories from them?
Yes, I've heard, as a matter of fact, last week I've talked to a patient. He says, I feel much better now, and it's like I'm getting back to be myself, and now I remember why. And that is a very important statement. She remembered why. It was a very horrible trauma, a car accident, as a matter of fact, and ever since then, she wanted to numb herself and forget the trauma, and that's how it all started. And so forth. So she had an aha moment, so to say. Yes,
for sure. And I know that trauma plays a large hand in that, and that's where Western medicine can come in certain ways, and Eastern medicine. All right, well, that's fantastic. So I think that anybody who's watching who maybe they need this, or maybe a family member, this is some great information, and they can go to soulsurgery.com to learn more.
Yes.
All right, I love it. Dr. Tepete, thank you for being here.
Thank you.
Mr. Fulop, thank you so much for your time. All right, guys, stick around because we got more of the mix coming up after this.